PACE Gonioscopy Lecture, Part 2. Following up on our last lecture, we will continue our discussion on the clinical technique of gonioscopy. In order to facilitate the whole procedure, you'll want to have the eye anesthetized to increase patient comfort, and we will use proparacaine hydrochloride 0.5% for this. Before we put drops in the eye, we want to check the name on the bottle to make sure we pick the right drug. We want to check the expiry date on the bottle to make sure that it isn't outdated and it's suitable for use. Then, we'll instill 1 drop of proparacaine in the lower fornix of each eye. It's probably not a bad idea at this point to check the name of the drug right away after you've instilled it, just to be sure that you did in fact have the right drug. If, for some reason, you happen to instill a wrong medication, you may have some opportunity to rinse it out with saline before it has its effect. At this point, we may occasionally apply some pressure to the inner canthus, just to block the drainage of the tears and drug through the lacrimal drainage system. It keeps it in better contact with the eye for just a few minutes. Just another comment about the use of drops. Once you've instilled the drop, you want to make record of that on the patient's chart. You'll want to record the name and concentration of the drug, the dosage, how many drops you used, into which eye you instilled the drop, and the time of the day it was instilled. You must warn patients about the use of anesthetics because the eye will be numb. If they inadvertently rub the eye, they could cause some superficial damage and not be aware of it until the drug wore off. So we usually advise the patient not to touch and rub their eyes for about 20 to 30 minutes after the anesthetic is instilled. For the initial preparation of the lens, ensure to always wash your hands as it is a good infection control practice. Using an alcohol swab, wipe down the slit lamp chin rest and forehead rest and let them air dry. Adjust the patient's height in the slit lamp the way you normally would for a slit lamp examination. We want to do a preliminary adjustment of the illumination of the microscope. We want the illumination lined up with the microscope. In other words, 0 angle between the light and the microscope. We also want to start with a low to moderate magnification. If you start with the magnification too high, it's sometimes very difficult to orient yourself once you start looking through the lens. So get your initial orientation with low magnification, and you can always go to higher magnification later if you need it. Also, start with a moderate slit width, somewhere between 2 and 4 millimeters. You don't want it overly wide because it's bright and it may be uncomfortable for the patient. If it's too narrow, you may have trouble localizing and finding things. We've had the lens sitting in the peroxide solution while we get the patient ready, so we'll get the lens rinsed and then fill the concave surface of the lens about 2/3 full with Celluvisc. The lens is now ready. Instill the anesthetic in both eyes of the patient. It only takes 20 to 30 seconds for the anesthetic to have its effect. By the time the patient settles down, with excess tearing and so forth, they'll be ready to go. Position the patient in the slit lamp. Identify the mirror that you're going to be using for gonioscopy. Remember, it's the thumbnail mirror. We usually try to place it on the eye so that the mirror is located at the top or in the 12 o'clock position, and that will allow you to view into the inferior angle. The inferior angle is probably the best place to start because it's the widest open, and the structures in the angle are the most easily identified. Once you've identified structures in the inferior angle, going to the other aspects of the angle, kind of around the clock, will be a little bit easier. For the process of inserting the lens, ensure that the patient is in the slit lamp. You don't want to insert the lens first and then find that the patient is not in the slit lamp and have to move them into position while maintaining the lens on the eye in the correct position. Have the patient look up, and you'll place the lower edge of the lens on the lower lid margin. Push the lid down so that the lens is making contact with the lower bulbar conjunctiva. At that point, the lens is holding that lid in position, so you can let go of the lower lid. You may need to then hold the upper lid out of the way. While the patient is still looking up, just tilt the lens slowly up onto the eye. At that point, you can often release the upper lid and let it rest gently on the top surface of the lens. Slowly, have the patient look straight ahead so that they are now in the primary position. The eye will come into position directly behind the lens. Step 1. Use the edge of the lens to hold the lower lid down in place. While you slide the lens down into the lower fornix, it's resting on the lower bulbar surface. Hold the upper lid up out of the way and tilt the lens into place until it's resting entirely on the globe, and then have the patient look straight ahead so that they're looking straight through the lens and you're looking straight through at the eye. At that point, if you have the gonioscopy mirror at the 12 o'clock position, you should be able to view the inferior angle through that mirror.